Hello, everyone. Welcome to another episode of Know Your Calling Team, where we help to get you, where we introduce you to several branches from the doctors who are specialized in their own branches. Today, we have with us here the co-founder of Rehabilitation, Dr. Ignatius Jacob Emmanuel. Welcome, sir. Today, he is here to help us get a better understanding about the branch PMR, which is Physical Medicine and Rehabilitation. He is currently working as the managing director of JH Rehabilitation. He has worked as an associate professor in SRM IST Chennai, and he was working as an SR, where he also did his MD at St. John's, Bangalore. His area of specialty are corrective exercise, neurorehabilitation, cardiovascular fitness management, and musculoskeletal injury. So, hello, sir. How are you? How did your day go?
It was good. Thank you for the kind introduction. So, hope you're doing good as well. It was fine. My day was fine. I'm just finishing with my work at the hospital at SRM Medical College. Just an hour, I'll be moving to my practice center, JH Rehabilitation.
Okay, sir. So, how does your general week look like? What is the schedule you have?
I wouldn't say like it's just very busy or anything. So my day starts at SRM Medical College. I start at 8 o'clock in the morning, and then I'm here till 2:33. So I finish here, and then I go to my practice, private practice, which is JH Rehabilitation. I'm there till 7:30. I have my private patients and practice there, and then that's my routine almost typically for 5-6 days a week. So the weekends are pretty much the Saturday evenings and Sundays I'll be resting. If at all, I'll be doing some tele consultations.
Okay, sir. So how is it? So do you have OP, the rehabilitation procedures? Is it all there on the same day?
Yeah. So let's say first before getting into that, I think we have to understand the concept of rehabilitation, right? So that's very important.
Yes, sir.
Because nowadays rehab, when we say rehab or rehabilitation, people tend to relate directly with physiotherapy. So but that's not the case. Rehabilitation as such, it's it's restoring the ability back for a person who had undergone some form of life-changing condition, be it stroke or any kind of disease condition which is altering their routine life. So where rehab means that restoring their abilities back at least to the limit or the level which is possible. So here it's not only we're talking about one component of rehab, which is physiotherapy, whereas there's a lot of other things involved. There's medical management, the surgical rehab is there. There's other allied rehab specialties like occupational therapy, speech therapy, etc. So to answer your question, how would the practice be in terms of whether it be OP and therapy every day? So what we do is, as rehab medicine physicians, so we act as team leaders to a multidisciplinary or an interdisciplinary team. So we have several paramedical branches under us. So physiotherapy, occupational therapy, speech language pathology, clinical psychology, nutrition, rehabilitation. So they all will be working as a team, and we would be leading them. So let's say that there's a patient coming to us, and then as the physician, as me, we would be doing the initial assessment, address the medical issues, and formulate an overall plan. And the individual team members will be addressing that. So I would say the mix of let's say OP, we would be creating plans, and then we'd be also we have inpatient wards. So where we'll be admitting patients who would need inpatient rehabilitation. We will be rounding on the patients to address medical conditions at the same time, rehab related concerns. So this is how we manage the therapy. Yeah.
Okay. So along with that, you have explained to us how the branch is in general. Thank you for that, sir. Now, how will the life of a resident be? How is it different from when you become an associate professor or a consultant? How is it different for the students taking the MD?
Yeah, so I think life of a resident, I would say, is basically it's good. It's very rewarding personally for me. So, it is very important. It's not like mainstream branches, like medicine, surgery, pediatric orthopedics. Physical medicine and rehabilitation, it's a quite, I wouldn't say a new branch, but it's been there since World War II. But only in the last few years, like the last decade, the knowledge about rehabilitation is slowly picking up. So, you know, and as I had mentioned before, we would look at the patient as a whole. We don't look at curing a problem, because people come to us with severe disabilities, after spinal cord injury, after traumatic brain injury. They come to us with severe impairments and disabilities, and we can't look into a cure, because those kind of impairments and disabilities are like set for life. But we could change their functional abilities with whatever impairments or disabilities which they have. So, but like to going back, I would say, like to answer that question which you asked, like how would be a life of a resident. So first thing is to understand what is the specialty itself. Like it's not that we just find the specialty and go and start doing it, but first trying to understand the specialty, because like I said before, it is not like a straightforward specialty where medicine, we know, like, okay, a patient come with a certain disease condition, we treat in the ICU, or we give certain medicines and the patient gets back. Whereas in physical medicine and rehabilitation, it's not that case. We treat all kinds of patients, from pediatrics to geriatrics. So where the spectrum of conditions is going to be a lot. So first, anyone who want to get into physical medicine and rehabilitation should have a clear idea in terms of what the life ahead looks like. That is very important. First, someone who's willing to, or like willing to explore physical medicine and rehabilitation, or rehabilitation medicine, they have to understand the core practice of PMR. Only if they're very convinced about that, they can enjoy the practice. So without having that knowledge, what happens is people might choose the specialty and may not come out with the expectation. So I can give an example about myself. So when I finished my MBBS undergrad in 2010, so after that, I was not very much interested, although I like medicine. I'm not like, I was very much oriented towards the core specialties. And since I was involved much in sports, so I was looking to do something in sports. So that's when I started exploring, and I was working in few hospitals, and then I took a year break to understand what has to be done, and etc. So when I was exploring about sports medicine, I didn't. I found sports medicine very an interesting field, because you've been involved with elite level player practices, very lucrative also. But I found that sports medicine is very narrow. I'm going to treat only musculoskeletal conditions. I'm not going to get involved in other kinds of rehab. So that's when I started to look for what other options we have. And then through my friend in the US, I got to know about this specialty called physical medicine and rehabilitation. So then I started looking into the branch, and then found out, it became like quite interesting, where physical medicine rehabilitation specialist, or we are also called as physiatrist. So we can branch into all kinds of rehabilitation: sports medicine, pain medicine, geriatric medicine, pediatric medicine, or like things like that, pediatric rehabilitation medicine, to say that. So just you can imagine like that. We have general medicine, we have MD general medicine, and then after MD general medicine, you could do cardio, neuro, or you could do DM, and all these specializations. So rehabilitation medicine, or PMR, it's like general medicine for rehab. So after you do PMR, you could even specialize. You could narrow down your practice to sports medicine, or pain medicine, geriatric medicine, things like that. Depending upon what your interest gets into. So I then like found out, okay, this seems like more broad, and then like I can treat a wide variety of patients. So then I found out which colleges can provide those facilities, and I found out St. John's, and then I wrote exam, and then I got selected for PMR there, and then that's how my journey started. And I can keep talking about it, but I think like with further questions I could add more ideas or more thoughts in terms of what a resident can expect in PMR.
Okay, sir. So, sir, you're saying we will have enough free time also if we choose this branch.
Yeah, see, it depends on like how you want to take it. It's like you're just looking into. Obviously, there is a lot of free time. It's not like a physically demanding job like orthopedics or be it medicine, where you'll be doing a lot of duties or ICU calls, etc., emergency calls. Here, emergencies are there, like, but those are all not very, very, uh, uh, very less, I would say. If in case you're attached with a hospital or like a medical college hospital like me, so there would be like calls here and there, but not very busy. It depends on how we keep our practice. There'll be like a lot of free time for you to do a lot of things as well. But since it's an upcoming branch, there's a lot of scope in terms of what more we could do in terms of how we could position ourselves. Because what I am thinking is, like the very few doctors in India who like practicing mainstream physical medicine and rehabilitation. So I would want to position myself as one of the lead physiatrists in India. So I would want to do a lot of things related to that field. So it really depends upon your how do you want to keep your life. But in the other case, like you feel like you don't want to have a busy practice, but I just want to have a practice, then now it is fine. But it all depends upon individual perspective. But for me, it is like I wanted to create more awareness about this field. Yeah.
Okay, okay. Okay, sir. I hope you are successful in that endeavor. Now, sir, how do we prepare as an aspirant to pursue PMR? How should we train ourselves? Apart from the study, I mean, the mainstream study part and the NEET preparation part, how else what all quality should we add into ourselves? Or what kind of personality shouldn't take this course? What do you have to say about that, sir?
Yeah, so again, like I will go back to my example because I can't clearly define that like this personality can would be suited for this field. So when I got selected into physical medicine at St. John's, uh, my interest was majorly in sports medicine. But when I started my residency there, I came to realize like there's predominantly neuro rehab based practice than sports. So then I had to go through a big transition in terms of to understand because I didn't really understand the core. Uh, uh, Although I had an idea about like the spectrum of problems physiatrists can handle, my interest was like in sports medicine. But
Okay,
somehow like in my residency medical college, it was majorly a neuro rehab based practice. So the first year was quite busy, and then second year we came to rotate in different areas. That's when I started to realize the importance of neuro rehab itself. So this neuro rehab uh, uh, practice grew over me. So now I'm practicing more of neuro rehab than sports. I would say like it's 70% neuro rehab and 30% sports. So who can take this out? Like how would you want to prepare this? It's like I think now everything goes through NEET, I guess, right? So
yes,
before
sir.
in those days, like in 2014, that's when I joined my residency at St. John's. So back then we could write direct exams. If you like a branch, let's say like radiology, orthopedics, or PMR, you have the opportunity to just write exam for that
Branch.
branch.
Okay.
That was available in CMC Vellore and St. John's. So I gave CMC Vellore and St. John's, but I got selected in St. John's. So, but now everything goes through NEET. So I think like there's a lot of colleges which are starting to offer MD-PMR, although like not very much, but very few colleges. So what I would say is basically from my experience is basically I came to understand about this branch more after I took it, rather
Oh,
than I had a big idea in terms of what this branch the scope of it. But I had grew a lot of interest to the field after I started the practice or after I was doing the residency. So you have to be in terms of rehab, it's patience, right? So if you have a mindset of a surgeon, or if you want to be very quick, or like like rehab, it's more patience. I would say you have to be very patient, especially if you're choosing PMR. Your majority of your practice is going to be neuro rehab. So when I say neuro rehab, it's going to be spinal cord injury, traumatic brain injury rehab, etc. So their recovery process is long, and then like you have to be very patient in terms of handling the patients. You should be able to manage a team. So the advantage of this specialty is basically you know not only practicing medicine, you'd be able to manage a multidisciplinary team. Like I mentioned before, you would be handling a team of 7, 8 specialists under you. So you cultivate the habit of how to manage the team, managerial skills, etc. will also grow with you. So people who are interested in managing things, or people who are interested in looking into giving I would say restoring abilities for patient, and who has the capacity to be very patient with patient, are right candidates, I would say.
okay, sir. So you're saying we should be a long-term investor in our patients, and
Absolutely,
we should be a team leader.
absolutely, yes.
Okay, sir. So now what are the advantages and disadvantages of the branch?
Um, so I wouldn't say like for me, I don't see any. When now I think it's a lot of advantages. But back when I started in 2017, like 5 years back, so the at the start of the disadvantages. So there is not much of awareness about this specialty. So no one knew what is a PMR, what is physical medicine and rehabilitation. So everyone was thinking, okay, like rehab, or like after any acute illness, okay, physiotherapy is there. So when I finished, there's not much jobs available. So that pushed me to start my own venture. So to create a presence, luckily with the PMR fraternity in India, with their outstanding efforts over the last many years, over the last decade, NMC made physical medicine and rehabilitation mandate from 2020 onwards. So
Okay.
now, like all medical college should have PMR as a mainstream branch, and then they're bringing the curriculum and MBBS also. So the disadvantages is even now there's going to be job now. I think like the scarcity of job would be reduced, but the awareness among the medical fraternity and people is still very less. So that is the
Okay, sir.
biggest drawback, I would say. Even amongst doctors, uh, very few know what a PMR or a physiatrist would do. So that is the biggest drawback. And I think like with years, that should change. That is a major disadvantage. Other than that, I don't see any other. But like that is something which has solutions which could be addressed. Advantages per se, it's very rewarding personally and gratifying in terms of what you could do to the patient. Especially with regards to neuro rehabilitation, when patients with spinal cord injury, stroke, or any kind of brain injury, giving them some form of ability back. It could be speech or motoric ability, or like even family support, etc. So that gives a lot of gratification in terms of what we give back to the patient. And the other advantages, like I wouldn't say, like it really depends upon individual to individual. Like, so these are the two major factors which for advantages and disadvantages, I would think personally for me.
Okay, sir. So the emotional gratification is what is the best about this?
Yes, yes.
Okay. So what about the patients? Do we have our own patients or are they referred to us? How do they come to us?
So, physical medicine, PMR, basically it's a referral specialty. Because rehab can happen only after any kind of injury or any kind of disease condition. So, eventually, a patient coming for rehab would have had some acute intervention. It could be a knee replacement, it could be stroke, it could be spinal cord injury, etc. So, pediatric cerebral palsy or pediatric developmental delays, etc., geriatric conditions. So, our referral doctors or referral departments could be anyone, starting from pediatrics to cardiology, neurology, neurosurgery, even obstetrics and gynecology, because pelvic rehabilitation plays a major role nowadays. So, the referral, majorly we get referred to, the patient get referred to us from other departments, but there are scenarios where people directly find us. For example, in my private practice, people do find us directly. Even though they've been doing rehab elsewhere, they find us and they come to us directly. But eventually, they would have had some acute problem which would have been managed. But not all doctors know about PMR, so they wouldn't know to refer to us. So they will say like you would have to do rehab or you'd have to do physiotherapy. So it's basically majorly referred, but I will say now with from my private practice, I can say that like a lot of people are trying to find through Google or like other social media platforms about rehabilitation, and wherever they find good quality work, they try to reach us. So I would say like, but the awareness level is less among the medical fraternity. So which would improve over time, but majorly it's going to be referred from other departments.
Okay, sir. Sir, coming to the settlement time, how much time would it take on an average scale for us to settle if we do MD in PMR?
So settling it depends upon what is your thought, imagination in terms of settling. It could be settling. I really can't really give an one line answer. Is it money you're talking about, or is it the work satisfaction you're talking about, or is it like what do you really? So settlement means different person think like different ways. So majorly, I think like money in terms of reimbursements or returns which you get after you get the department. Is that the
Yes, sir.
question? Okay.
Yeah.
So money wise, I would say it's good. It's good. It's now with NMC bringing PMR into the mainstream MBBS branches. So I would say it's equivalent to all the medical or like medical branches because we get reimbursed very well, and the demand is there now because since there are few colleges which is offering MD PMR, but since the NMC has mandated PMR, there's so many medical colleges are searching for PMR doctors. So our demand is there. So you just have to decide what you want to settle with. So based
Okay.
on that, I think it'll be fine.
Okay. So now, while choosing a college to do your MD in, how should we choose the college? Like, is it more of patient inflow, or what criteria do we keep?
So first, I would say like choosing the college right now in India, like very few colleges offer MDPMR. So first, understanding the specialty is very much important before trying to venture into selecting the colleges. So I would say talking to physiatrists or people who have graduated from different universities or different medical colleges can give a good idea, because each since the new branch which has been mandated, different colleges which are providing NDPMR have their own uniqueness. So I wouldn't say like like this has the best practice, because for example, if you take general medicine or general surgery or orthopedics, you can say okay, there are like so many colleges offering MD general medicine, MD general surgery. So there you can pick to say that okay, I want the top 20 or 30 medical colleges in India and get into medicine or surgery. But in physical medicine and rehabilitation, there's very few colleges in India which offers MD seats. So wherever you get, it's going to be
Pick it
good.
up. Okay.
But you just have to talk to the. It's better always to speak with people or like doctors or physicians who passed out of those colleges, and then get their ideas, get their suggestions. But personally, I would say like when I started looking about physical medicine back when I was trying to do residency in PMR, I wanted to get into see the CMC Vellore or St. John's. So, but they are both very good. They do give a good quality education from my perspective.
Okay, sir. Uh, sir, can I ask you the next question?
Yeah. Please.
Okay. So, sir, what are the possibilities of super specialization, fellowships? What is available in the field?
So, like I said before, you just have to think about rehabilitation as a base in terms of general medicine. You do general medicine and then you can specialize into various super specialty branches like cardio, neuro, etc. So in India, like after PMR, after MD-PMR, there is no DM or other higher degree courses. There are fellowships. There are neuro rehabilitation fellowship. There is pain medicine fellowship. Uh, palliative pain and palliative medicine fellowships are there. But those are the three fellowships which are available in India. But if you're looking to go outside, abroad, or like to the US or to the UK or even Australia, the options are many. For example, I can list the list of fellowships available after PMR. So you have starting from neuro rehabilitation, you have brain injury medicine, you have spinal cord injury medicine, pain medicine, pediatric rehabilitation medicine, palliative medicine, geriatric medicine. So the list goes on. So since we address from pediatric to geriatric, so we'll be like there'll be like a lot of specialized sports medicine. So the abroad where you can the options are more, but in India, the available fellowships I would say pain medicine, neuro rehabilitation medicine, and then like those are the two sports medicine fellowships are there, but like they're not like very good. Especially you could do central, like for example, the one in Safdarjung, Delhi. I think they offer a sports medicine fellowship. So, so there are very few fellowships in India, but outside India, there are a lot of options.
Oh, okay, sir. Sir, lastly, would you like to bust some myth about PMR, which is going on in the medical field?
Bus about PMR. I don't know, like probably with the latest NMC mandate, probably there is the demand is there now. So I think like since there is a lot of demand, like the value and return increases for PMR doctors, especially at least for the next 10-20 years. So a lot of talk is happening in those lines, because any department which has been mandated by an NMC, it's been like just a year and a half since they brought out a mandate. So the growth is going to be, the growth will start from now. Although the department is functional from the 60s, 70s, the growth will start only when the National Medical Council or the MCI recognizes it. Recognizes in the sense like when they bring into the core curriculum.
Yes,
To
sir.
give you an example, for example, radiology, like radiology back in the 80s, and then like how they grew to become one of the highly lucrative fields now. So since they're mandated now, it all depends upon how we are able to bring the awareness among the fraternity, so that a lot of other young aspirants could take the specialty. So right now, from the PMR fraternity, there's a lot of work happening to bring awareness about the specialty, so that this keeps growing and a lot of people would want to choose this specialty as a career.
Okay, sir. So, would you like to tell us an inspirational story or an example, something related to the branch for aspiring students about PMR? Maybe
Uh,
a personal story or a famous story which is being told in the PMR field for a long time. Anything?
PMR field, uh, nothing, like I wouldn't say like I haven't heard of any stories though, but like since there is very few doctors already, so what I would something inspiring is basically learning from patients. Uh, uh, this is one branch I would say where we learn from patients. Uh, so how I would say is because other specialties, the patients are just dependent on the doctors. So in rehabilitation, you'll be associated with the patient for a very long time, or like for the entire lifespan itself. For example, in spinal cord injury, I've been in touch with lot of patients because where these spinal cord injury, just to give you an example, uh, after spinal cord injury, there are some practices like clean intermittent catheterization, where they lose their bowel and bladder sensations. They develop neurogenic bladder and bowel, and it is not advisable for them to continue on indwelling catheter for a very long time. So we train patients to catheterize by themselves. That procedure is called clean intermittent catheterization. So
Okay, sir.
this is one thing which I get surprised from my patient, and I learn a lot and use that as an example to tell other patients, where they'll come up with innovative solutions to address things. Because
Okay.
imagine like they lose their bladder and bowel continence, and they have to catheterize themselves once in 4 5 hours. So they come up with innovative ideas how to do it, how I manage this problem in my office. And they're not like they're paraplegic, and they're not ambulant, they'll be wheelchair ambulant, but they're going to office, working and having a productive life. But they'll be example to other patients. So we have support groups. For example, here at SRM, we are doing a program called SEED. It's called SRM Education for Empowering Persons with Disabilities. So,
Yes.
where the idea of this program is, we would bring together, this is a support group, we'll bring together a group of spinal cord injured patients, or any patients with any disabilities, and they'll be asking us questions. So, so when they ask some questions, the answer would come from another patient,
Okay,
because
okay.
they had already had that experience. So they'll be teaching. So we'll be learning from them. Oh, okay, this can be done, because they're all from remote villages and remote India. So this I would say is like it's more inspiring, in terms of, for me, in terms of like what. Although we are specialists in the field, there is so much to be learned from the patient itself, because always they say, like even though like we study, we practice, and then do, always the patient would have upper hand in terms of what they are going through. So that is
Experience
always
makes
been
them
very
innovative.
inspiring. Yeah, very inspiring for me. And my seniors and professors would always think, like they always have trained me in terms of listening to the patient. uh, it's PMR consultation is not like general medicine. And I wouldn't want to compare, but it's always long. Our consultation is always long. Average 20 minutes to 30 minutes. So So we listen to a lot of their stories, and then it is quite interesting that way in terms of how much we could learn from them.
Okay, sir. So, is there anything else you would like to add before we wrap up the interview?
Uh, yeah, I think like pretty much I've touched every aspect. So what I would just want to finish up with is basically uh, uh, physical medicine and rehabilitation has it is a very rewarding field. Anyone who would want to try something out from the routine in terms of you want to try getting into other some other explore new branches. Uh, this would be one of the one which is extremely rewarding in terms of your practice. As I would say, like a relatively, not relatively, a completely stress-free life, and a rewarding practice. Uh, you can since it's a new branch, it is you're gonna come up with setting standards nationally or representing India, because it's only a year or 2 years since the National Medical Council has mandated PMR. So young aspirants getting into PMR, this is the right time, because coming out and there's going to be a lot of questions available in central institutions, be it AIMS, uh, uh, etc. And then like all the state medical colleges are going to have PMR field as a branch. So all I want to say is like, just try to understand about the branch before getting into it, and then speak with people or speak with doctors who have finished PMR so that they get an idea. If possible, trying to visit their practice, having a look at their practice. So all those things can help them in terms of developing the interest, because anyone who would want to just get into this field, they won't be able to get any idea at all, because this is a very very a niche branch for me, at least. Unless and until you go and experience, go and observe, go and talk to people who had practiced this specialty, you wouldn't be able to come to a decision to
Oh,
whether to take this branch or not. So, but like like personally for me, I am happy that like even though I was interested in sports, I found out this branch and then grew a lot of interest in neuro rehabilitation, and I'm happy that like I'm able to do a lot of work related to that field, and I'm happy to see a lot of patients becoming independent in their life. So one thing I just wanted to, I probably missed this. I mentioned like we look at the patient in terms of not curing but restoring their abilities. So that is the most important thing, which I would say compared to other branches. Our branch is like basically trying to restore the abilities. We're not looking to cure patients. So that is the take home here. So we wanted to create some kind of productiveness to a patient whose life is completely in shatters. So that is something which no other specialty could offer personally, for my point of view. So that is something which I would want to leave behind, and I would love to mentor in terms of if there are any other young aspirants who would want to talk to me to understand more about this specialty. I'm available in my center or other practice. So this would be my end message, I would say.
okay. So, thank you, sir, for your time, patience, and experience filled enthusiastic answers. The KYC team is really thankful and we really appreciate it. I'm sure the audience will find it very useful too. Thank you for your precious time and we hope you have a great day.
Yeah, thank you so much, and, congratulations to the team who's doing this amazing initiative. It's very much needed for young aspirants or young doctors to know what they're getting into, and I congratulate Dr. Diari for taking up this initiative and educating people on this. And I'm happy to be a contributor in this. Thank you so much.
Thank you, sir. I'm sure Dr. Dari will be very pleased to hear it.
All right, thank you, Neha, for your good interview. Thank you.
Thank you, sir.